controlled, right? In that case, you know, let's say I would have a big gash here, very close. At that point, I would come over, and what you're gonna do is you're gonna have your gloves on, right? You would normally have your gloves on, and then you're gonna have positive control of the roll. So you keep positive control of your roll at all times, because you don't wanna have to, if I'm like this, if I do this, now my roll maybe touches the floor, I'm getting it dirty, stuff like that. Now I'm increasing the chances of contamination, right? I'm trying to keep as much of the sterile cloth available as possible. So and it's gonna be a lot harder for me to pack this like this, or even try to start wrapping around my wound if I don't have positive control of my roll. It's gonna be a lot harder for me to get it around every time like this than if I already have it all rolled up, and I'll show you about that when I have the trauma bandage here, okay? So basically, you're gonna go ahead and you would, here, let me roll this up real quick. This is one that's already set. All right, so like this one's already rolled up, right? Just to save a little bit of time. First thing I'm gonna do is I'm gonna come up and I'm gonna pack. I'm gonna start packing positive control of my roll, and I start packing into my wound, right? I'm packing with my fingers, I'm putting pressure at the same time, and you know, maybe I'm gonna come into this crevice and keep packing, then eventually I'm gonna come into this crevice, and I'm gonna keep going all around, trying to go like in a 360 like pattern, trying to pack. So for purposes of time, I'm gonna say that I already packed all of this or most into the wound as much as I could. It can't go in anymore. I'm applying good pressure, all right? You can hold direct pressure there for 3 minutes if needed, depending how you feel. You see what your intervention needs to be. Once that pressure is being held in place, you can even have something here that can slightly elevate the leg, like their book bag or a trauma bag or something like that. You place it on there, have the legs elevated. That's also gonna help treat for shock a little bit, right? By having the legs elevated, and then you're gonna come over. Once again, you got your positive control of the roll, and then you're gonna place that over the wound, and then you're gonna go to work. Still have positive control of my roll. I'm not being dainty with this. I'm tightening it up. I want to make sure I stop my blood, right? So I'm gonna come over. I'm gonna come one time through the friction adapter. If you all get a little closer, if you can't see, but you're gonna place it here. You're gonna feed it through. You're gonna feed it through, and then you're gonna come over. What this does is this ring is causing pressure. Okay, I'm gonna feed it through. Now the second time, this time I'm gonna pull it the opposite direction. Okay. This time I'm gonna pull it the opposite direction. And I'm gonna come over, then I'm gonna start covering the white, right? So the sterile area, I'm trying to cover that, okay? I'm trying to cover that, but at the same time, I'm trying to keep pressure. So I'm holding it, and each time that I'm coming around, I'm tightening up, and I'm pulling, tightening up some more. Just imagine doing this with your full kit, helmet, all that stuff. And in the desert, it's hot out there, you know what I mean? But you do what you gotta do to make sure that that person stays alive, right? And in some of your settings, depending on what you do, you'll be doing this in the air conditioner in a tent as a second lieutenant, you know, just providing your interventions if needed. Okay, so that's pretty much how it'll be. Every time I'm coming around, I'm coming up nice and tight. Okay, here I already know I'm probably not gonna be able to get it around that much anymore. Flip it around and then just kind of try to snag it in. All right, now I would come over here, and then this is a 3-inch tape, roll of tape. This is our best friend on the field, right? You see how I have it what I call dog-eared right here. I don't have time to start peeling this tape off right now. What I'm doing, I dog-eared my tape. That way it's ready for me to peel and do my intervention as I need to, right? So I'm gonna come over. I got my tape right here. Now I'm gonna make it look a little pretty, if I have the time. So normally we'll have a team. We got a bleeding guy, an airway person, an IV person, all of us just going to work at one time on that person once they're in the aid station, okay? And then so that's basically what I do. I can even come around one more time and do my bandage just like that, okay? I don't have to worry about that. Now I can come over and dog ear it again, and then I start worrying about my other interventions. Hey, you okay? You all right? Continuous assessment, right? Making sure they're okay, making sure they're breathing, they're talking to you, they're conscious, and then later on you'll worry about getting them out of shock by IV intervention, right? So we don't really have time to do most of the other improvised techniques and stuff like that, but we're definitely willing to come again at another point to be able to go into those interventions as well. You can just pass up your tourniquets to the side.